So I'm Lewis Hotchkiss, and I'm the Research Officer at Dementias Platform UK. I first started working on the neuroimaging capabilities and the infrastructure of the data portal and building that up to enable the sharing and analysis of more large, complex data. But more recently, I've been working on leading responsible AI development and ensuring that AI models developed on our data in TRVs are private, unbiased, sustainable and robust, so they can be safely translated into clinical practice.
So there's a lot of buzz around AI at the moment and as a tool for data analytics, and its use seems to be growing. I just wondered if you could provide a brief overview of just how AI is used in data science and data analytics.
Yeah, well, AI research has definitely grown over the past few years, and even within Deep UK, we've really seen a rapid increase in applications for developing AI on our data. It can be really useful for a lot of things, and we can see the potential that we're starting to see now in AI model development, especially for translating these models into clinical practice to improve patient outcomes and diagnosis and treatment. Now, a big problem in health data research for AI has often been a lack of openly accessible data sets. Now, something like Deep UK alleviates this problem by bringing together over 60 cohort datasets we have now, to be able to train and validate AI models on, to be able to build robust models which can be validated in real-world settings as well. Some of our cohort collections contain real-world memory clinic data, which is really useful for being able to validate these models and make sure that they can be clinically translated from the trusted research environment. The AI models that are being developed in Deep UK, we see a lot of AI models being used to discover new biomarkers, to find effective treatments, to be able to model prognosis and be able to aid clinicians in making their diagnosis. So such a wide range of different applications to AI that we're seeing within Deep UK. We're really now starting to see the potential of these AI models being developed and translated into clinical practice. And this has only really now been due to having large enough data sets which you can bind together to be able to develop AI models. And so trusted research environments really play a pivotal role in this, to be able to bring together these lots of different data sets, to be able to standardize them and allow easy access for researchers to be able to develop those models on. So it's really because of TRVs bringing these data sets together that we can now develop AI models in healthcare.
Are there any drawbacks or inherent risks of AI within the field of data research and health research as well?
Yeah, so we've actually been leading some research recently on looking at the risks of AI models developed in sensitive healthcare data. So we brought together members of the public, AI researchers and data providers to assess the kind of risks and concerns in AI models and how they could be mitigated and what TRVs can do to help researchers implement safe AI in their research. So we identified lots of different concerns, and one of the main things is if you're publishing an AI model on something like GitHub, which people might usually do for open and reproducible purposes, then you open that AI model up to be attacked by adversaries. If you take something as simple as an instance-based model, like a support vector machine, it actually contains instances of the training data within the architecture of that model. So some AI models will try and learn the patterns of the data to make predictions. Instance-based models actually contain the data within them. So if you're publishing an AI model which is instance-based, then you can actually extract specific instances of the training data. And so, of course, then you're revealing some of the sensitive healthcare data which that model was trained on. So, of course, we don't want that to happen. Then in other types of AI models, they can be vulnerable to certain attacks, either like membership inference or attribute inference, or even reconstructing the original training data in those AI models. So we really have to be careful of what AI models we're sharing and how they can be mitigated. And the kind of results that we got from the workshop was researchers aren't aware of these risks of sharing AI models. They don't know that they can be vulnerable to these types of attacks. And so training is really imperative to be able to enable researchers to understand these risks and how to mitigate them appropriately.
So if the data is leaked somehow from an AI model, my understanding is that data is anonymized. So what's the actual risk to individual privacy?
Yeah, of course. So in Deep UK and many other TRVs, we make sure all data is anonymized. And so when you're training AI models on this data, that data is anonymized. But if that data is leaked, there is still the potential for re-identification. There was some interesting research done recently which looked at that re-identification risk in anonymized data sets. And they were able to actually find and re-identify a lot of individuals within anonymized data sets just by a few different common attributes. And they built an interesting statistical model as part of this, this, where you could see the combination of different attributes and how that affects the risk of likelihood for re-identification. And so for a fairly average person in the UK, the re-identification risk is fairly low. But if you look at more minority groups and people with rare conditions, we can see that re-identification risk drastically increase. So in the statistical model, just changing the marital status from never married to same-sex partnership, that re-identification risk jumped from 2% to 82%. And this is really a common theme that we found in our public workshop, where people with rare conditions or from ethnic minority backgrounds felt that they were at higher risk to these sort of attacks and vulnerabilities in AI models. So we really need to ensure that even though our data is anonymized, that we're making sure it's still kept private and secure.
And so given these risks then, are there any mitigation techniques that researchers and data scientists can employ to help mitigate these risks?
Yeah, so thankfully that there is, and we evaluated these different privacy preserving techniques in our workshops, and we found that a lot of these techniques can be quite hard and difficult to implement. So we've been working on developing tools to help researchers implement these techniques into their research. So something like synthetic data can be used to be able to train AI models on more private data, where some noise is added to that data to ensure that you can't identify specific individuals within that. So we've developed tools to help researchers generate and evaluate synthetic data, and to be able to find the optimal trade-off between sort of privacy and utility, so that it can still build effective AI models but keep the privacy of the individuals to do that. And there's also lots of other different ways that we can preserve patient privacy. But I think, again, training is really crucial to help researchers understand how they can mitigate these, because it really depends on the types of AI models that you're implementing and the type of data which is being used as well. So something like neuroimaging and genomics can present more difficult challenges in mitigating those. So we're looking to build resources to help researchers implement these techniques into their research.
Okay, so thanks, Liz. Yeah, that's really, really useful and really interesting. I just wondered if you could explain a bit about what is the role of TREs in ensuring AI models are being developed and shared safely?
So one of the key recommendations from our workshop findings was the application of the FAIR framework to AI models. So if you're not familiar with the FAIR framework, it was originally applied for the use of data to make sure that it's findable, accessible, interoperable, and reusable, to ensure that we enable open and reproducible science in health data research and allow researchers to be able to reuse this data in their own research. But we need to apply this one step further to AI models to ensure that they are also findable and accessible and can be reused, so that we can validate these models and reproduce them on external data sets. And so we can do this by publishing the AI model via the trusted research environment, rather than going to GitHub to publish an AI model. That way we allow these models to be accessed in a secure way while still maintaining that patient privacy. So that's a really crucial aspect. Another way we can enable AI models to be shared via TREs is through secure hosting. So if you want to deploy your model in a clinical setting, then we can keep that AI model within the trusted research environment and enable that to be queried through some sort of form of API, so that we can enable the patient privacy to be preserved and that model still to be used in clinical practice. And of course, as well, if you want to validate AI models in something like Federation, you can use this to train other data sets on your AI model and to be able to validate them. So Federation offers a suitable solution as well to that. So TREs really offer all these different solutions to be able to share AI models in a safe way, rather than just publishing them into the public domain where they could potentially leak patient data.